So, my life experience that led me on this path to becoming a nurse practitioner is that both my parents are nurses, and I kind of looked up to them growing up and felt that nursing is a very good career. And all their stories they told me when they came home and their interactions with their patients made me really want to become a nurse and kind of fulfill their shoes. They're both nurse practitioners, and now here I am, second in line in the family to be a nurse practitioner, and my wife's a nurse. So our whole family is kind of in nursing, and I gotta say it's a pretty rewarding and pretty, awesome career. I feel like it's better than being like a tow truck driver where you're screwing people over every day. At least as a nurse, you get to make a difference in a positive way in someone's life. My greatest success so far, I would say, is as a nurse practitioner student in the urgent care setting. We had a patient come in who was severely bradycardic at 36 beats per minute, and she had a EKG I never even read before. I never even I could. It was not something that was very common. It wasn't like a normal sinus brady. It was definitely something was going on. But I went through the patient's medical records that her daughter had brought with me and saw that the patient was recently placed on digoxin, and that the nursing home, in our area was not considered to be one of the, best nursing homes to give medication. So I actually we ran a dig level on this patient, and it turns out the patient had toxic levels of digoxin, and she was sent to the emergency room immediately to be given Digifab, which I thought was, my preceptor thought was a very good catch, and that was probably the most success I ever had in treating a patient. What challenges do I have? I have a lot of challenges, I guess I would say, with assessment, especially all the musculoskeletal assessments such as Lachman's, the posterior drawer test, getting those down, and doing Tinel's test and reminding myself that this is, for example, the posterior drawer test. What ligament are we actually testing there? And I know it's the PCL, but going through all those thorough assessments and having a really good understanding of when to use them and when they're appropriate on each patient is something that I have a challenge with. What did I learn from this course? From the capstone course in particular, I learned that a lot of work and time goes into research. I learned how to write an abstract. I think that's the second time in my whole educational career. I think I had to write one in the end of my bachelor's program, and this is the second time I've ever had to write an abstract. So that was interesting to learn how to write that and become more polished as a writer. I also learned that all the crazy statistical methods that can go on, and how to use effective testing for what variables you want to use, and what is the software that all involved in doing data analysis. So I thought that was very interesting. What are my future goals? My future goals are to pass boards and get a job. That would be really good. I think that's everybody's goal. I also want to get some kind of specialty certificate. I was looking at oncology as a possible thing that I could be interested in, or maybe even doing something like cardiac or GI, kind of to set you apart from other nurse practitioners. And then it makes it a lot easier when you're the doctor or provider, that's hiring you is saying, hey, what is your experience in, cardiology? I'm like, well, I already have my certificate for nurse practitioner in cardiology, or I'll have my oncology certificate. So I think that gives you a little more credibility when applying to a job. So that's something I would like to do. And ultimately, my future goal is to start my own practice. My friend is a physical therapist, and we always joke we can have like a one-stop shop for physical therapy and primary care, and we could just refer patients to one another. And I thought that was something interesting and something I might want to pursue down the line.